Hi everybody. Welcome to our chat about diabetes. My name is Dr. Julie O'Keefe. This is Cathy Heilig, who is a certified diabetes nurse educator and nurse practitioner. And we're here tonight to talk about diabetes because November is National Diabetes Awareness Month. Now, diabetes is a very large topic. But what we elected to talk about tonight is, number one, how the disease can be prevented. And number two, if you are diabetic, what do you need to do to keep yourself healthy? So let's just start from the beginning. What is diabetes? Well, diabetes is an illness that occurs when the blood glucose levels are too high. Why does that happen? Well, when we eat, we use what we eat for energy, and so the food has to be broken down. And the main components of our energy is carbohydrate. When the carbohydrates are broken down, we use that for energy. But for the carbohydrates to be broken down, insulin has to be working and has to be present. So when people have diabetes, either their pancreas doesn't make any insulin at all, or their body cannot use the insulin that their pancreas is making, and they have diabetes. Now, the most two common types of diabetes are type 1, which occurs when the body does not make insulin at all, and type 2 diabetes. Most people have type 2 diabetes, and that's really what we're going to be focusing on tonight. So the other issue with diabetes is that 30 million people have the disease. But what's even more frightening is that 84 million people have prediabetes. There the disease can be prevented. So Cathy, why don't you tell us about prediabetes?
Well, there are several risk factors for prediabetes. Two main risk factors would be if you're overweight, or if you're inactive or have a very sedentary lifestyle, you're going to be more likely to develop prediabetes. Also, age can play into it if you're over age 45. Ethnicity, African American, Asian population, and even Indian populations can be very high risk. Of course, genetic predispositions, your parents may have had diabetes, brothers or sisters. If you're a woman who went through pregnancy and had just something called gestational diabetes, then you have a high risk for developing diabetes later in life. And gestational diabetes, you could have been treated with insulin perhaps, or you could have just modified your diet and made some changes to keep your blood sugars under control. You may have had an infant who's greater than 9 pounds. That's another indication that you might have had problems with insulin during your pregnancy or controlling blood sugars. The other thing to think about too as a risk factor would be having a history of high blood pressure or high cholesterol. If you're being treated for both of those, then you most likely are at risk for having diabetes as well. And you may need to do something about it.
And does it matter that if the more risk factors you have, the more likely it is that you're going to be pre-diabetic?
Yes, most likely. If you're racking up the risk factors, you're probably looking at a pretty good pre-diabetic, either having pre-diabetes currently or moving right into type 2 diabetes. They're very close linked.
So how is the diagnosis made? If someone suspects, if somebody has many risk factors and they think they may have it, how is the diagnosis made?
It's going to be made through blood work primarily, because you're not going to have symptoms of prediabetes. So if you come into the office and we do blood work and your blood sugar is, say, above 100, but under 125, that is a risk factor, especially if you're fasting. If you came into the office and you did not eat anything for 10 or 12 hours and you have a blood sugar of 105 or 110, and then we will typically see a little bit of a pattern continuing with that over the next few blood draws, then you do have to be very concerned. Also, there's a test called an A1C, and what an A1C is it looks at your red blood cells, and red blood cells act like sponges and they soak up sugar. And over 3 months, we can look at how much sugar these red blood cells have soaked up, and if it's a high number, 5.7 to 6.4 would be pre-diabetic, then that could give another indication. But the good thing is it is preventable. You can prevent going into type 2 diabetes, and the best course of action is to become active. You need to increase your activity. You need to lose weight, at least 5% of your weight. It could be 10 pounds, 15 pounds, could be very important. Changing your diet, decreasing your calorie intake, decreasing your carbohydrates and sugar intake are very important. But the idea is that you won't have symptoms. You need to be very proactive so that you don't develop type 2 diabetes.
So as Cathy mentioned, prediabetes is something that you have to suspect because of risk factors, and you have to get tested for it. It is also preventable, or reversible, so that if people can lose 5% of their body weight in a year, you can actually prevent the onset of type 2 diabetes. But what happens if that doesn't happen and you are diagnosed with type 2 or you develop type 2? Well, just like prediabetes, a lot of people who have type 2 diabetes don't even know they have it because you don't have to have symptoms. You can have symptoms though. The higher the blood sugars are and the longer it's been going on, you can get symptoms. Some of the common symptoms that can occur with type 2 are frequent urination, hunger, weight loss, blurred vision, numbness in the feet, and in women, yeast infections. Some people will also have an infection that doesn't seem to get better, it doesn't seem to go away, and that is also a risk factor or a symptom possibly of type 2. But again, a lot of people don't have the disease and it goes undiagnosed. So then how is it made with blood testing? As Cathy mentioned, a hemoglobin A1C level is used to make a diagnosis and also to look to see if the diabetes is controlled. So like Cathy mentioned, prediabetes is when the A1C is between 5.7 and 6.4. If the A1C is above 6.4, you have the disease, you are diabetic. If your fasting blood sugar exceeds or is greater than 125, you have the disease. And if a random blood sugar at any time during the day is above 200, you are diabetic. So, what happens when you're diagnosed with diabetes? It is not the end of the world. It is something that is treatable, but it takes work, it takes time, it takes medications. So, what do we use to treat the disease? Well, as Cathy mentioned, lifestyle changes are key. Losing weight, being active. The American Diabetes Association recommends 150 minutes of exercise a week. You can break that up as much as you want. 30 minutes, 5 days a week works for a lot of people. But weight loss and exercise are key. The majority of people, however, with type 2 will require medication. And most people with type 2 diabetes require 2, 3, sometimes 4 different drugs. Why is that? And the reason that we need so many is because it's not just a problem with the pancreas. even though that's where it starts. But if you think about all the organs that play a role in adjusting glucose, it's the stomach, the skeletal muscle, your brain, and your liver. And there's not one drug out there that hits all 4 of those targets. So the majority of people require multiple medications. Now the good thing is that there are 10 different classes of drugs that can be used to treat type 2 diabetes. Some are pills, some are injectable, and then there's insulin. And 85% of people with type 2 diabetes will require insulin in their lifetime. So don't fear it, it's a drug that works. So when we're treating diabetes, what are the targets? And where your blood sugar has to be, or where your physician wants your sugar to be, a lot of it depends on you as a person. But if you think about and know what the ADA, the American Diabetes Association, recommends, they recommend that in people with type 2, the A1C is less than 7, that your fasting glucose is less than 130, and that 2 hours after eating, your blood sugar is less than 180. Again, those are guidelines, and they may be different for each individual person, and that's something you talk about with your doctor. So we now know what it takes to treat. We now know what the risk factors are, and we know what the goals of therapy are. Why do we do this? Why is it important to treat diabetes? Because diabetes has complications. Some of these complications, the most important ones, are life-threatening. People with diabetes are 2 times more likely to suffer a heart attack or a stroke. It doesn't matter how old you are. It doesn't matter how long you've had the disease, but those are the 2 biggest life-threatening risk factors. So that's one of the biggest reasons why we treat. It's also why, when you're being treated for diabetes, that it's not just about your blood sugar. As Cathy mentioned, if you have high blood pressure and high cholesterol, those are risk factors. Once you're diabetic, those need to be treated as well. What are the other complications that we think about? The ones that are intimately associated with high blood sugars. Nerve damage, that can be neuropathy in your feet. Eye damage. Diabetes is the leading cause of adult blindness. Thank goodness that now they can prevent blindness by doing laser on the eyes, but years ago, that option wasn't there and people became blind. The third thing is you can develop kidney disease. And if it's not treated, you can wind up developing kidney failure and requiring dialysis. So having said that, and again, this has been a very brief discussion about diabetes, it is important for you to know what the risk factors are of prediabetes. And if you believe you have those, to get tested. If you are diabetic, it's important for you to check your blood sugar, to take your medications, to stay active, and lastly, to make sure you're getting regular follow-up with your physician. Cathy, would you like to add anything else in?
I don't know, just don't gain weight and be as active as you can. If you have any questions out there in TV land?
All right, the first question is, what are some changes I can make in my diet to lose weight?
Excellent question.
Reducing
Would you like me to take
calories.
this? Yes. Very simple things you can do. Avoid sugar. Decrease your carbohydrate intake, which would be breads, spaghetti, noodles. Try to eat whole wheat type of products. Stay away from fruit juices. Stay away from regular sodas.
Stay away from processed food. You know, so many people nowadays, because of how busy they are, don't have time to cook. But most processed foods are going to be so much higher in carbohydrate, in fat, and sodium that it's really important, if you have the time or to try and make the time, to cook at home, to use real food rather than the stuff that's already processed. The processed stuff is easy, but it's not healthy.
And portion control. You need to make sure that you are not eating too much of any one thing. Try to have a nice variety, non-starchy vegetables, green bean, broccoli, cauliflower. Stay away from potatoes and rice and heavy starches. That's probably the main thing. Don't skip breakfast. People love to skip breakfast. Have something very small to start your day. And that's it, I guess.
If I have prediabetes, will I develop type 2 diabetes?
Not necessarily. So what we know is that if you have prediabetes, and as Cathy mentioned, if you are able to lose 5% of your body weight, 5% of your body weight in the course of a year, you will reverse and prevent type 2 diabetes. Now, the harder thing is that if you're able to do that in the course of a year, you have to sustain it, because our bodies become more diabetic-like as we get older. As Cathy mentioned, a risk factor is aging. You can't stop the aging process yet. So if you're able to reduce your body weight and stay active, it has to be something that is sustained for the rest of your life.
And is whole wheat pasta a good choice instead of regular pasta?
It's a better choice, definitely, but you do have to watch the portion controls. It can be very high in calories. So look at the serving sizes, and also you have to be careful about what you're putting on top of the pasta, because there's a lot of sugar in some ingredients. So it's best that you make your own sauce, perhaps, and then you won't have so much sugar that might be in prego or ragu.
And the reason that whole wheat pasta is better is anything that has fiber in it. And so that would include anything that's brown, right? Whole oats, whole grains. So brown pasta, brown rice, sweet potatoes instead of a regular potato. Anything that has fiber in it, the more fiber something has, the less likely it is the blood sugars are going to go up. That's why it's so important to have fresh vegetables, because they're very high in fiber, and fresh fruit because they're very high in fiber, especially if something has a skin on it, like an apple or a pear. The amount of fiber that's in your diet will lower your blood sugar. The more fiber, the less likely it is your sugars are going to rise.
Excellent point.
All right, well, I think that's it. We've covered a lot of material. I would just say that to everyone out there, if you think you're pre-diabetic, go see your doctor. If you're already diabetic, please listen to what your doctor's telling you, and have a wonderful evening.